Sweet hellos from South Africa. I am Meena Soni. I am currently doing my postgraduate diploma in diabetes through the University of South Wales. I have a keen interest in diabetes and I am passionate about empowering patients with this disease using knowledge of diabetes, such as complications thereof. Diabetes is a chronic condition affecting more than 400 million people worldwide, which is an astonishing 1 in every 11 people. In South Africa, heart disease and stroke are the biggest killers after HIV and AIDS. A vital step in taking care of yourself is protecting your body from hyperglycemia. This is high blood sugar that causes direct and indirect effects on the human vascular system. It is also a major source of morbidity and mortality in type 1 and 2 diabetes. Type 1, also known as juvenile diabetes, occurs when the pancreas produces little to no insulin. Insulin is a hormone, produced in the pancreas responsible for allowing glucose to enter cells in order to produce sufficient energy. Type 2 on the other hand, is known as adult onset diabetes and is associated with high blood sugar, insulin resistance, and lack of insulin. It is linked to metabolic syndrome, which increases the risk of a heart attack and stroke. It is also associated with obesity and lack of exercise. Another type is gestational diabetes, which affects a mother during her pregnancy. Further injurious effects of hyperglycemia can be divided into macro and microvascular complications. Micro means small and vascular refers to vessels, which means that these complications affect small blood vessels in the body found in the eyes, kidneys and small nerve fibers. Similarly, macrovascular complications affect bigger vessels found in the heart, brain and extremities. These complications are usually a result of high blood pressure, insulin resistance and excess free fatty acids. The focus of this video will be on macrovascular complications, particularly linked to cardiovascular disease. Cardiovascular disease refers to narrowed and blocked blood vessels that can lead to a heart attack, chest pain, angina or a stroke. As you may already know, diabetes is a major risk factor for cardiovascular disease. Cardiovascular disease is the leading cause of death in diabetic patients, with majority dying from either a heart attack or stroke. It is also important to note that most diabetics do not die from diabetes but from related complications or secondary illnesses associated with diabetes. Cardiovascular disease is also known as heart disease because it affects the heart and its vessels. The 3 most common diseases that occur are coronary artery disease, cerebrovascular disease, peripheral arterial disease. This includes arrhythmias, stroke, cardiac arrest and congestive heart failure. As a result, there are 2 main conditions that can occur. Arteriosclerosis involves stiffening of the walls of the blood vessels supplying oxygen and nutrients from the heart to the rest of the body. This can lead to high blood pressure. Atherosclerosis occurs when fatty deposits, known as plaque, build up on the walls inside the vessels, ultimately causing narrowing. This restricts blood flow to organs and tissues, which can lead to a stroke. But how does diabetes cause heart disease and plaque formation? Diabetes is linked to the development of atheroma. This is the degeneration of the arterial walls due to fatty deposits in the arteries that ultimately results in narrowing of the vessels. High sugar levels damage the inner lining of blood vessels, making them hyperpermeable and cause the buildup of fatty deposits over time. The subsequent narrowing of the vessels is what is termed atherosclerosis. Smoking and hypertension magnifies the effects. Coronary artery disease is the most common form of heart disease involving narrowing of vessels, which can lead to a heart attack. However, carotid artery disease is narrowing of vessels supplying blood to the brain, which can lead to a stroke. Peripheral arterial disease is narrowing of vessels supplying blood to the arms and legs. Decreased blood flow to the legs cause cramping, which is also known as claudication. In severe cases, ulcers or diabetic foot can occur. Healing is slow and poor, which can eventually lead to gangrene and amputation. Therefore, daily foot examinations and foot care is vital. Diabetes is currently the #1 cause of non-traumatic amputations worldwide. High sugar levels can also cause stiffness in the heart muscle, which can lead to hypertension and heart failure. High blood pressure can lead to a stroke as a result of weakening the blood vessels in the brain. This can cause them to narrow, rupture or leak. Diabetes itself is a risk factor for heart disease even when glucose levels are normal or maintained. Diabetics have a more than double the risk of developing heart failure, more so in type 2. High blood pressure, abnormal cholesterol levels, obesity, lack of exercise, poorly controlled blood sugar, smoking, individuals with insulin resistance and diabetes or a combination as well as any of the above risk factors put individuals at a greater risk of heart disease or a stroke. So now that we are aware of what complications high glucose can cause, what can you do to manage it? Heart disease may be the leading cause of death, but that doesn't mean you have to accept it as your fate. It is always worth remembering that prevention is better than cure. Screening for macrovascular complications include examining pulses, analyzing lipid profiles, examining ECG results, and monitoring blood pressure readings. Although you may not be able to change unmodifiable risk factors such as family history, sex or age, there are some key modifiable heart disease prevention steps to help reduce your risk. Let's get started. Stop smoking. Because smoking is a risk factor for heart disease, causing damage to your heart and blood vessels, which leads to atherosclerosis and then a heart attack. The best solution is to quit. Your risk of congestive heart disease drops to almost that of a non-smoker in about 15 years. Try and exercise for about 30 minutes a day, 5 times a week. Exercise and maintain a healthy weight can offer heart benefits, but bigger benefits are more noticeable by increasing the intensity, duration and frequency of your workouts. Eat a heart-healthy diet with greens, beans and leans. Avoid excess salt, sugar and saturated fats. Healthy fats help your heart by reducing bad cholesterol. Limit your alcohol intake. Ideally it should be 1 drink a day for women and 2 drinks for men. Maintain a healthy weight. Being overweight and obese increases your risk of heart disease. Excess weight and metabolic syndrome also increase this risk. Reducing your weight by 3 to 5% can lessen your risk of diabetes, blood pressure and cholesterol levels. Get enough quality sleep. People who do not have enough sleep have a higher risk of obesity, increased blood pressure, heart attack, diabetes and depression. Adults need a minimum of 7 to 9 hours of sleep a day. Manage stress. Physical activity, yoga and meditation can help improve stress. Get regular health screenings. High blood pressure and cholesterol can damage your heart and blood vessels. Ideally your blood pressure should be 120/80. Anything over 140/90 is considered hypertensive. It is important to obtain HbA1c of less than 7%, but targets need to be individualized by your healthcare provider. Controlling HbA1c levels is the key to the successful treatment of type 2 diabetes as well as the benchmark for defining glucose control over a long period of time. Furthermore, glycemic control is the cornerstone of reducing end organ disease. It is important to adhere to your medication regimens and a healthy lifestyle. If you have not had a previous cardiovascular event, aspirin is not advised. But, if you have had an event, such as a stroke, heart attack or any form of angina, discuss aspirin therapy with your healthcare practitioner to weigh out the pros and cons. Know your ABCs. You may not be able to change your diagnosis, but you can certainly change your prognosis. Remember.